All right. Well, great. Thank you, everyone, for attending today. I know it's a beautiful day outside. It's going to be rainy the rest of the week, but glad you came in today. My name is Paul Connor. I work with Mass General Brigham Health Plan, Medicare Advantage. Okay. Okay. All right. So today, what we're going to do is we're just going to go through Medicare 101. Okay, just a review of how Medicare works, the different options that are open, and again, this is how it stands today. I'll speak briefly to some potential changes for the coming year, but again, nothing is specific, nothing's concrete. All I can do is give you a glimpse into the possible changes that may take place. Okay, but thank you for coming. So we're here to make Medicare easy, right? Medicare is easy to understand. It's a piece of cake, right? Right? Very funny. I gotta start with a joke. So basically, we want to talk about the A, B, C's, and D's of Medicare, okay? So we'll review each of those and what they do, what each does. Medicare Part A, okay? When you turn 65, as long as you've worked, you're automatically given Part A. And what you want to think of when you think of Part A is everything associated with inpatient hospitalization. So anytime you're hospitalized, skilled nursing facilities, rehab facilities, hospice, should you ever need it, all falls under Part A, okay? Part B, okay, is given to you by the government once you elect Part B. So this is when you're going to retire, okay, or turn 65 and you're going to go on Medicare. Part B, okay, if you think of it as everything associated with your doctor. So all your office visits, your primary care, your specialist visits, tests, MRIs, things like that, outpatient surgery, all falls under Part B. Part B has a monthly premium that you pay for Part B. Okay, this year, the average, it was about $174.50 for the average person. If you're a high wage earner, it could be more. Okay, that's what's called original Medicare, Parts A and B. Okay, I'm going to slide all the way over to D. D for drug. Okay, that's your Part D. That's a prescription drug plan that you need to purchase after you go on Medicare, because original Medicare, Parts A and B, do not include prescription drug coverage. Okay? Now, Part C, okay, is what I'm here to talk to you about, Medicare Advantage plans or supplement plans. And what Part C plans do is they help you alleviate some of the out-of-pocket costs that are associated with original Medicare on A and B. Okay? So I'll go through those in an example in a minute. Okay? So people have two options really to go to help them with those out-of-pocket costs, either a supplement plan or a Medigap plan you might hear people talk about, or a Medicare Advantage plan, which is becoming more and more popular, which we'll discuss those as well. Okay, everyone good so far? Okay. So, Medicare Advantage, when you look at when we compare to what original Medicare covers your Part A and your Part B. Okay. So do the Medigap plans, the supplement plans. They also cover your Part A and your Part B. And then you'll see the second bullet down provides supplemental coverage to lower your out-of-pocket costs. So supplement plans or Medigap plans do that as well. Medicare Advantage plans do both of those two, Part A and Part B, and they provide a lower out-of-pocket cost, but they also include your prescription drug coverage, extras that include benefits like hearing, vision, dental benefits, weight loss reimbursement, gym reimbursement, things that you became accustomed to while you were working on your group plan or on your individual plan, okay? We also have lower premiums, lower premium plans compared to that of a Medigap or a supplement plan, okay? And the reason why a lot of folks look for the supplement plans or the Medigap plans is because there's a lot of out-of-pocket costs associated with Parts A and B. For example, on Part A, there's a $1,600 deductible that resets every 60 days. Every 60 days. So heaven forbid you're hospitalized a few times within the course of a year, that can really start to add up over the course of a year. So that's Part A. Part B, there's an annual deductible of $265 that you pay before Medicare pays any of your claims. Okay? What? 240. I'm sorry. After that, Medicare is going to cover 80% of the cost of your claims. So you're going to be responsible for 20% of an office visit, a specialist visit, that outpatient surgery, MRIs. You'd be responsible for 20%. So again, if you have a tough medical year, that 20% can really start to add up over the course of the year. And the biggest issue with the Part A and Part B, original Medicare, is there's no max out-of-pocket coverage. So you could really, if you have a terrible health year, really incur a lot of bills. So that's why people look to add a supplement plan or a Medicare Advantage plan. And the Medicare Advantage plans have max out-of-pocket limits on them, which we'll talk about, okay? So looking at the plan benefits for the Medicare Advantage plans, they include all your primary care, well checks, wellness visits are all covered at 100%, just like they are on every other plan. But it includes, like I said, dental care, hearing and vision exams at no cost, okay, as well as additional benefits to those services. You have coverage for emergency room or urgent care wherever you are. If you're out of the state, you always have access to emergency care or urgent care. Okay? If you're out of the country, you also have coverage for emergency care and urgent care. Out of the country, if you're in Italy, unfortunately, they're not going to know who Mass General Brigham Health Plan is, right? So in that example, if you have an emergency, you would pay for your emergency with a credit card. You're going to get the medical bills when you return to the States, and you would submit that to us or to whatever Medicare Advantage plan you were using. And then we're going to reimburse you. You're going to bring your credit card statement. We'll reimburse you all the way down to whatever your in-network copay would have been for an emergency visit. Does that make sense? Okay. But anywhere in the United States, you have emergency and urgent care. Wherever you go is going to automatically bill as in-network. Okay.
No pre-clearance?
No. For an emergency visit, no. So as I said, all your preventive care is covered at 100%. Okay, your annual physicals, colonoscopies, mammograms, bone density scans, all these things are covered at 100%. Okay. Inpatient hospitalizations, both for mental health and substance abuse, along with traditional inpatient hospitalizations are covered. And then I mentioned the emergency and urgent care covered worldwide. Okay. Outpatient surgery, ambulatory surgical centers, outpatient surgeries are all covered on this plan as well. Obviously, there's different copay levels and things like that for certain services, which we can get into. X-rays, your testing is all your blood work has no cost share, but all of your X-rays, CT scans, MRIs, things like that are covered with more traditional copays rather than paying 20% of the cost of a test or a procedure, like you would if you just had original Medicare.
Any frequency we should only one next day?
No,
It's not. There's no.
no, as needed. You know, if it's ordered by a physician, of course. Yeah. So skilled nursing facilities are covered, home health care, physical speech and occupational therapy, should you ever need it, are covered, again, with a copay. And we have no 3-day inpatient hospital stay required for skilled nursing facilities. A lot of plans will have that. We have to stay in the hospital for 3 days before they'll send you somewhere else. We don't have that. So if after day one, they deem you're ready to go to a skilled nursing facility, you can go. And again, this is the most important part of it, the max out-of-pocket coverage. So on each of our plans, you'll have a maximum out-of-pocket amount for in-network and then in and out-of-network combined, okay? Our plans, for example, on ours, are PPO plans. So there's in and out-of-network benefits, okay? But in network, your max out of pocket means everything, any copay that you pay, any coinsurance added up cannot exceed a certain amount in a given year. Okay? So that's your protection. Okay? And there's different levels. Added up. So all of your copays, so your copays to see a physician, your copays to see a specialist, your copay for an MRI, should you have a hospital stay, those are covered with copays as well. All of those added up over the course of a year. Each plan has a certain max out of pocket. So if you're paying a lower premium, it's probably a higher out of pocket maximum. If you're paying a higher premium, it's a lower one. Okay?
Not drugs.
Not drugs. This is just medical.
What do you mean by in and out?
So our plans are PPO plans, preferred provider organizations, which means there's an in-network of doctors and facilities, and then there's an out-of-network. You can go anywhere you want. So if you know, say your doctor, say you need a specialist or you need a surgery, and a friend of yours says, you got to go see this doctor, he's the best in the world, right? But he doesn't happen to be in your network, okay? On a normal plan, an HMO, things like that, you wouldn't be able to go. You'd pay 100% for that. On this plan, you'd be able to go, and there's out-of-network benefits for that. Okay? So, let's talk about the elephant in the room. Prescription drug coverage. So, it's very, very complex when you move over to Medicare on a prescription drug plan. It operates very differently than it does with the plans that you were on through your employer or your individual plans as you were growing up. So we use CVS Caremark. That's our mail order pharmacy. We'll talk about that, but I want to talk about every carrier has varying tiers. So their formulary of drugs is broken down into certain tiers between generic, preferred generic, or non-preferred generic, brand, and then your specialty drugs, okay, which are the higher end drugs. So we have a 5-tier pharmacy platform on our plans, which we'll get to, but the 4 stages of your prescription drug coverage are the same on every Medicare plan. We all have to follow the same rules, okay? The first stage is a deductible, your yearly deductible stage. This may be an amount of money that you have to pay before you start paying any copays for your prescriptions, okay? Stage 2 is what's called the initial coverage stage. This is where you're going to pay your copays for your services. Number 3 is the coverage gap or donut hole. How many people have heard of the donut hole? Okay. I went through it. My mother went through it. She battled cancer. It's really something you have to be very cognizant of and understand it. But as I said earlier, there are changes legislation is coming, hopefully, knock on wood, this year that would possibly eliminate that. We don't know yet. We haven't had, Medicare does not allow us to talk about January 2025 plans until October 1st. So at that time, there's going to be a lot of information for you to kind of get up to speed on at that time. So during the coverage gap or donut hole, you're going to pay 25% of the cost of the drug, which we'll get into in a minute. And then stage 4 is your catastrophic coverage, which that means you've reached a drug cap and you don't pay anymore. The insurance pays everything else, which we'll discuss shortly. So stage 1, like we said, a yearly deductible stage. A lot of plans might have a $250 deductible before you start paying your copay, things like that. On our plans, we don't have any deductible, so you go right to stage 2.
So does that mean full price?
Yeah. So stage 2 is what's called the initial coverage stage. So I want you to think about 2 buckets beginning to fill during this period, okay? The first bucket is what you pay out of pocket, what your copay is. If you're on a tier, say you're on a tier 4 drug with us and it's a $100 copay, for example, $100 is going in that first bucket, month 1. The second bucket is a combination of what you pay and what we pay as the plan to cover the full cost of the drug. So say, for example, that drug, that tier 4 drug, actually costs $1,000 a month. Just for simple math, say it's $1,000 a month. So that second bucket, your $100 is going in, and then we're putting $900 in, okay? To make the $1,000, to cover the $1,000, okay? That second bucket, once that second bucket reaches $5,030, this is now just for 2024, if it reached $5,030, you go into what's called the coverage gap or donut hole, okay? At that point, you would then pay 25% of the cost of the drug. So in our example, that $1,000 drug, 25% of that would now be $250. So you would be paying $250 per month for that drug for the remainder of the year, as opposed to the $100 copay. Okay? Now, while members are in the coverage gap, or the donut hole, a lot of drug manufacturers will provide discounts, right? So members can take advantage of these discounts while they're in that stage, okay? Now again, that 25% that you're paying keeps going in bucket 1, right? That's just your out-of-pocket cost, okay? Even if you get a discount from the drug manufacturer, they're gonna count the full cost to go into your first bucket. So it helps you accrue. Because once you get to that first bucket reaches $8,000 in a given year, you go what's into stage 4, the catastrophic coverage, where you don't pay anymore.
8,000.
First bucket. Yeah. Right. But depending.
I'm just saying, in your example, you don't get there.
Right. In my example, you don't get there. Right. But there's a lot of people with multiple drugs, multiple specialty drugs, where this is a real issue, right? Paying that kind of money. Okay, so like I said, there's legislation that could have changes to this for the coming year. I'm hopeful that that'll happen. But, you know, with every change, there's negative to it.
That $2,000 comes from the drug manufacturers.
Yeah.
The patient has to talk to the drug manufacturer or the healthcare plan?
Yeah, you would have to be, on the forefront of outreaching. We have folks within our plan we have care guides, for example, in our plan, that can assist you with outreaching and connecting you with the right people. So there's other ways to save money on the prescription side. There's federal subsidy programs. There's state pharmaceutical assistance programs that you can sign up for, especially if you were in that kind of situation. But like we said, hopefully, things will change for the better. Again, getting to, the Medicare Advantage plans, and what people like about them is that you're getting these extras that you don't get on a Medigap supplement plan or original Medicare, right? You have to purchase additional dental insurance. You have to purchase additional vision insurance. You're not getting any fitness reimbursement. But with Medicare Advantage plans, you are getting that. Depending on the plan, you can have anywhere from $1,500 to $2,500 in comprehensive dental coverage, in addition to 2 free cleanings a year. Okay? We have an over-the-counter medication allowance per quarter, where we'll send you a catalog this year. Is a catalog where you can purchase Robitussin, Sudafed, bandages, those types of things that you need on an everyday basis, and they ship right to your home, and you get an allowance per quarter, depending on the plan you're on, anywhere from $85 to $120. So a way to help you save money. Fitness reimbursement up to $300 per year. So it's not just for gym reimbursement. So it would be for something like if you bought a stationary bike for your home, those types of things, you'd be able to apply that to it as well. And then, as I said before, weight loss benefit of $150 towards a weight loss plan of your choice. Yes, there is. Yeah, we utilize, for us right now this year, is Liberty Dental, but again, that could be adjusted.
Where are they?
They're a smaller network, but they do have a substantial network here in Massachusetts.
So if you used your
No, I mean, it depends. I mean, I would look it up for you and tell you exactly who's in network and who's not. No, out you get something, but you'd have to pay the 20% of say it's a root canal. You would pay 20% of the cost of the root canal. The rest would go towards your comprehensive allowance. Okay? We also have free meal delivery for those up to 20 refrigerated meals after a hospital stay. So if you're hospitalized for a period of time, haven't been able to get groceries back to your house, we'll supply up to 20 meals. True Hearing is a company that we partner with for hearing aids. So we offer a copay anywhere between $6.99 and $9.99, depending on the type of hearing aid it is. So that's something that's there. And then we also have 24-hour, 7 days a week nurse hotline that is always available. So just to review enrolling in Medicare, just to give you the kind of the lay of the land, right? And the initial enrollment period, okay, is when you're turning 65, okay, or when you're eligible for Medicare. So the 3 months before your birthday month, and the 3 months after, that's considered your initial enrollment period. 7 months, okay, to enroll, okay? Annual enrollment period is October 15th through December 7th. So this is where you see all the ads on TV, and you're getting phone calls, and you're getting mailings, and everything's going crazy with Medicare. This is the annual enrollment period. So this is, once you're enrolled in Medicare, every year during this time, you have the ability to shop for another plan. Late in September, you'll usually always, the current carrier you're with will send you a notice of change letter. Okay, and that'll be, okay, here are the changes for the coming year for your plan that you're on right now. Okay, if you don't mind those changes and you don't do anything, well, then you'll renew on that plan. But if you decide, oh, I don't like those changes, that's too drastic for me, or this plan's not working for me, you have the ability to change at that point. You make the change then for January 1st of the following year. So open enrollment period is the period from January 1st through March 31st. This is where Medicare Advantage plan members can make a one-time election to go to another Medicare Advantage plan or back to original Medicare and pick up a prescription drug plan.
Back to original Medicare mean plus supplement?
No,
I can't,
parts A and B.
I can't take a Medigap with that original Medicare?
You can't go from a Medicare Advantage plan that year within the open enrollment period to a Medigap plan.
Only
You can at the following year during annual enrollment period.
all I can do is go to original Medicare with all its.
Right, or another Medicare Advantage plan that works better for you. No, you don't have to do anything again. It's just if you find, February 1st comes along and the plan's not working for you, it's not what you thought it was, and you're unhappy. Second chance.
Re-enrolled and I really don't
Right, right. So, and the last period is a special enrollment period. So that is when, so say for example, you're over 65, you're still working, okay, you have your Part A because you get that when you turn 65, but you're 67, you're still working, you're on your employer's plan, but you're deciding you're going to retire. But that's the time that you have to enroll. So if you're losing your coverage, say September, August 31st, and you want to sign up for September 1st, that's your special enrollment period. You can sign up September 1st. But then once you're enrolled, every year you have the annual enrollment period. But that was really it. The information on your chairs is information on the plans that we offer for 2024. There is also a Let's Get to Know You sheet. If you wanted to complete that, if you wanted to set up an individual call with me to discuss your plan, look at our plans, get more in depth in a conversation, you can complete those. My card is also included there if you want to outreach for a more personal conversation.